Good afternoon, everybody. I am Dr. Irgau. I think we are live. I am the president of CRIAS, the Christiana Institute of Advanced Surgery, and this is our weekly live broadcast that usually is undertaken with Kamal Erkan, the chairman of the American Surgery Center and the CEO of the United Medical ACO, but he's not available this afternoon, so I will be conducting this presentation by myself. We will be talking today about what to expect on your day of surgery as far as weight loss surgery or bariatric surgery is concerned. And then obviously, if there are any questions that come up, please feel free to send your questions. As you know, this broadcast, although it's being relayed through Zoom, it's actually being live broadcasted through Facebook Live as well as YouTube at the same time. Okay, again, as I said, my name is Dr. Irgau. I am the president of CRIAS, or the Christiana Institute of Advanced Surgery. I specialize in weight loss surgery or bariatric surgery. I have been doing weight loss surgery now for almost 20 years with my associates, Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, Dr. George Ibrahim. We actually are the most experienced practice in our area as far as bariatric surgery is concerned. We have actually performed many, over 7,000 very successful weight loss surgeries over the years. We have set up centers of excellence for bariatric surgery in our area, including our area's major hospital systems. So let's go ahead and talk about the topic at hand for today, what to expect on your day of weight loss surgery or bariatric surgery. So just to briefly introduce, obviously weight loss surgery or bariatric surgery is a very important form of treatment for morbid obesity. Morbid obesity is a condition that is defined by a weight of a person that has gone really to uncontrollable levels. The actual definition of morbid obesity is a weight of a person which is about 100 pounds, at least 100 pounds over their ideal or healthy weight. So if you were to take a person who is 5'5" in their height and their healthy weight is supposed to be 150 pounds, if they gain weight and their weight goes up to 250 pounds, that would be the definition of morbid obesity. And currently, by far the most effective treatment we have for morbid obesity is weight loss surgery or bariatric surgery. It is exceedingly difficult for a person who reaches that level of weight to lose the weight by themselves. And why is it important for that person to really have to lose the weight? Well, because not only their quality of life is actually impacted by that much excess weight, but also there are real health problems related directly to being obese or morbidly obese. And those health problems include things like that, developing things like diabetes, requiring medications, high blood pressure, sleep apnea, and many, many other illnesses that are directly related to obesity. So weight loss surgery is an important form of treatment. And obviously for a person to qualify for weight loss surgery, their weight has to be at the levels that I mentioned. But importantly, the person has to be evaluated by a specialist like myself, a bariatric surgeon, and found to be a good candidate for weight loss surgery. But then they have to undergo a preparation that includes being evaluated by a nutritionist, by a psychologist, perhaps getting evaluated by a heart doctor and a lung doctor as well, to make sure that they are in optimal condition for them to undergo surgery. So this preparation sometimes can take several months. And at CRIAS, we actually have a fairly well streamlined process guided by bariatric coordinators, people who really follow up with the patient to guide them and help them navigate through the process. So patients will undergo that type of preparation and um, then be ready for surgery. Okay, so most of our surgeries currently we undertake them at the American Surgery Center, which is an ambulatory surgery center that specializes in bariatric surgery. It's a center that has been accredited by the MBSAQIP, which is the most important accreditation system in our country as far as bariatric surgery is concerned. It's a center that has been accredited as a center of excellence for bariatric surgery. And as an ambulatory surgery center, actually, it's one of very few centers around the country that have such a designation. So most of our surgeries, again, occur at the American Surgery Center, and that's the place that I will be focused on to show you what to expect on your day of surgery. So let's say the surgery date has been determined, you are ready, you've done all your preparations, all the clearances have occurred, you've done your pre-operative diet to prepare yourself to shrink the liver, which is a diet that we administer, and the day has arrived. Okay, so the surgery center will do a number of phone calls in the days before the actual surgery date to give instructions and to prepare the person. One of the instructions, for instance, will be as to when to stop drinking or eating anything before the day of surgery. And they will also give instructions about what medications should be taken on the day of the surgery or the day before the surgery. So you arrive at the surgery center, you go to the check-in area, you check in, and then you will be presented to the nurses in the pre-operative area. The nurses will take the vital signs, they will prepare you in the appropriate area for them to start an IV and also administer necessary medications. Now, what are these medications that we have before surgery? There are some standard medications that have to be administered before any type of general anesthesia, but there are some specific medications that we actually provide in our center to do two things. One is to enhance the recovery of the person after surgery. So we prepare them before the surgery for them to recover really promptly after the procedure. And the second thing that we do is we provide medication to minimize some of the potential complications of the surgery, because prevention is by far much more effective in preventing, in dealing with the complication as opposed to treating the complications afterwards. So what medication do we use? Well, there are certain medications that we know that if they are administered even before the surgery, before the person goes to sleep, they are very effective. Some very powerful anti-nausea medications that are available only at our surgery center, as far as I know, in our area at least, to minimize the risk of severe nausea after surgery. Nausea can occur just because of anesthesia, but nausea can occur after bariatric surgery specifically. But this medication is a very powerful medication that minimizes that. We give proactively some medications that are not narcotic, some strong medications that actually minimize the transmission of painful stimuli after surgery, which means really they decrease the perception of pain afterwards, which means the person is more likely to be up and about early after surgery because of the decrease in pain. Now, utilizing these medications that decrease pain is extremely important, because not only it is nice that the patient doesn't have much pain, but more importantly, we don't have to administer narcotic pain medications afterwards. Why is that important? Because if we minimize narcotic pain medications, it means that the patient's head is going to be much clearer, much more quickly. The intestinal tract will not be delayed in its recovery from anesthesia. Okay? And importantly, as we know, in our country, we talk about too much utilization of narcotics leading to unwanted consequences later, right? Well, we minimize narcotics, and that helps us greatly. The patient's ability to breathe fully to be clear-minded and to walk around is increased if there is less narcotic utilization. So medication is given preemptively before the actual surgery to minimize nausea and also to minimize pain after surgery. Very important, right? Now, we give also other medications, for instance, like a blood thinning medication. Now, surgeons used to dread using blood thinning medications in the past before surgery because they were worried about bleeding. My teachers many years ago, when I was still in training, they didn't want any medication that could thin the blood because with the big operation that they were doing at that time, they were worried about bleeding. But now with laparoscopy, with minimally invasive surgery, bleeding is not much of a concern for surgeons because they do less trauma when they do the surgery. So bleeding is not a major issue with modern surgery, at least with the way we do it right now. So we're comfortable giving blood thinning medications before the surgery. But what is the advantage of being able to give blood thinning medication before the surgery? We can minimize one of the most serious complications of bariatric surgery, and that is formation of blood clots, right? Now, blood clots is one of the potential complications of bariatric surgery. It's actually one of the potential complications of any major surgery. And the best way to take care of it is to prevent it. And that's how one of the ways which we prevent it is by giving blood thinning medication before the actual surgery, before the person has anesthesia. So all these preparations will be undertaken in the preoperative area by the nurses. After that, the anesthesia team will take over and they will start their own medications after discussing all the anesthesia process with the patient, obviously. And then the patient will go to surgery and the surgery will be undertaken. And most of our surgeries, whether it's a sleeve gastrectomy or a gastric bypass, generally take about an hour 15, maybe an hour and a half. They are relatively quick procedures done laparoscopically. So one of the things that we do, that it is a very important component of the practice that we have at the surgery center is as the patient is still asleep during anesthesia, we administer targeted numbing medicine throughout the abdomen of the patient. Now, we administer this to really numb the nerve endings that supply the skin on the anterior abdominal wall. And that is an important thing for us to do because it means that although we've made small cuts and incisions, having numbed that whole area means that as the patient is waking up from anesthesia, they will not have that discomfort that they would be feeling, right, if we didn't have this numbing medicine. And this is something called laparoscopic tap block, something that we really have refined and we became experts on in administering at the time of the surgery when the person is still asleep, so that as the person wakes up, they will have less discomfort. Okay, again, another thing that we're doing proactively to enhance the recovery. Okay, now why is enhancing recovery very important? Well, who wouldn't want to recover quickly from surgery? Right? We all would want that. That's important, but there are other very important reasons. And what are they? Well, if the patient's recovery is enhanced, it's quicker, it means the patient will be up and about and in a vertical position soon, right? Why is that helpful? Well, remember, if we are up and about soon, our brain will automatically go into a recovery mode as opposed to going into a sickness mode as we're walking so early. Secondly, and most importantly, as we are walking early, we are minimizing some of the risks of surgery, including blood clots or pneumonias. We are taking deep breaths, we're walking around, and those complications can be decreased because of that activity. Okay, so enhanced recovery after anesthesia is a term that modern surgeons use nowadays to show that after having had even major surgery like bariatric surgery, you don't have to lie in bed in discomfort with nausea and then potentially being a target of complications. You can really bypass all that by having this wonderful preparation that will allow the person to recover quickly. So The numbing medicine has been placed in a targeted area around the abdomen. The person wakes up from anesthesia seamlessly without too much discomfort, without too much nausea because of the preparation, and they will go to the recovery area. One of the great thing about the surgery center is that the patient will actually have their own nurse, one nurse per patient during their recovery, right? So in other settings, we know nurses can be busy having to take care of many patients, which is something that occurs obviously in busy hospitals. But at a surgery center like ours, that specializes in bariatric surgery, where only a number of procedures are undertaken per day, it means that the recovery patient will have an nurse assigned to them, sitting there and checking on them and working with them to recover. And also these are nurses who also specialize on patients who have this surgery all the time, which means that they understand the needs of patients and they can anticipate their needs and obviously offer whatever help and treatment is needed at that time. So the protocol that we have at the American Surgery Center requires that the person is at the center being observed for at least 8 hours after their surgery. So they will have an 8-hour period in which they will be waking up, they will be up and about, they will be walking frequently, and they will be actually started on some oral intake very soon as well. And they will be starting to take some liquids, particularly if they don't have any nausea or that is well controlled, because that will also prepare them for eventual discharge. The vast majority of our patients who have surgery at the American Surgery Center are actually discharged not the same day. That's an area that we specialize on, which means that undertaking bariatric surgery in an outpatient setting safely. So our patients are up and about with minimum discomfort, with minimum nausea, and ready to be discharged within the same day, right? And if we can do that in a safe manner, who wouldn't want to be in their own environment, in their own bed, right, if possible? So that's a way of doing it. Now, I was going to mention that all these processes that I mentioned is actually illustrated also by my colleague, Dr. Michael Peters, who took the time to make a whole video that should be available on our list of videos on YouTube that will walk you through. And he actually also has the actual procedure, laparoscopic procedure in that video. So that's an interesting one. So if you search for Dr. Peters within the videos that we have on YouTube, you will find that as well. And it illustrates all the things that I have mentioned. Okay, so day of surgery, the preparation starts with the surgery center calling the patient days ahead and preparing them and giving them instructions, right, on what medications to take, on when to stop eating or drinking. And then the person coming to the center being met by the preparation pre and hold area, we call them nurses, that will prepare them with the medications that I mentioned that will allow the patient to recover quickly after the surgery. Obviously, when the person is in the recovery area, one of the most important things that we are doing will be monitoring, right? Continuous monitoring of the heart rate, monitoring of the blood pressure, monitoring of the pulse ox of the patient, all things that we have to make sure we stabilize to confirm that the patient is not encountering any complications or that the course is as expected, to make sure that everything is done safely. And that will happen throughout the time in which the patient is in our center. Obviously, anesthesia and the surgeon also will be available if anything is needed at that time. So what I did today is I've given you a brief overview of how bariatric surgery is undertaken in our surgery center at the American Surgery Center, which is a center of excellence for bariatric surgery. And it's a place where the surgeons at CRIAS, the Christiana Institute of Advanced Surgery, perform most of their bariatric surgeries. So I hope I've given you a good overview. This talk was specifically on the day of surgery, obviously, and the rationale for utilization of all the different preparation medications and protocols that we have to enhance recovery, as I just explained. But it is important to understand that this talk is not about the indications of bariatric surgery, obviously what bariatric surgery is, who is a candidate for bariatric surgery, what are the dangers of morbid obesity. All these are separate talks that we have addressed throughout these sessions in the past when Kamal Erkan conducts this weekly presentations with one of us, one of the surgeons. These topics have been touched upon. And if you go on YouTube, actually, there is a list of presentations that will go on to talk about those important issues. Obviously, these are general guidelines. These are general information that I'm providing as far as a particular person's needs, indications for bariatric surgery, whether bariatric surgery is appropriate for them. That will be determined only at the time of consultation. So if you believe you may be a candidate for bariatric surgery, call our office to make an appointment. Nowadays, many of our, at least initial encounters are occurring through telehealth remotely, which is very convenient for many patients, obviously. Where we'll be able to review all the medical history of the person and then see if they are candidates for bariatric surgery and what kind of bariatric surgery would be appropriate for them would be discussed fully at that time. So I am actually going to stop right here. And if Tanner or Melissa, if you guys are following, and if there are any questions that you're seeing from our audience, I will be quite happy to answer. If not, I will wait for a signal from you guys to complete the presentation today. So see if there are any questions. Tanner, if there are any questions, we can put them on the chat area. And if there are no questions, I think I am going to stop here. Again, I am Dr. Irgau. I am a bariatric surgeon with almost 20 years of experience with weight loss surgery. And I am getting some messages now. So let me see if there is any. Okay, so there are questions about the recovery time after sleeve gastrectomy. That's a great question, actually. So, okay, so the surgery is done. You left our surgery center the same day when you had your surgery. You're going back home. But the question now is, how long should you be off work, for instance, after sleeve surgery? Well, the minimum amount of time that we require for people to be off is actually 2 weeks. And it's important to understand here that excuse me, it's not being off for 2 weeks because you're physically incapable of doing things. Far from that. Excuse me. Far from that. In fact, we want you to be active. We want you to take care of yourself. We want you to be completely independent as far as taking care of yourself, right? But it's surgery, so you're likely to have less energy. And also, it is a time when you want to be really very attentive to your needs. There is a special diet that you have to have. So during all that time, you really shouldn't be going to a place where your main responsibility is to take care of somebody else's problems, because that's what work is, right? You go to work to take care of someone else's issues, right? Well, that is why 2 weeks is important, so that you focus on yourself and yourself only. So we ask for 2 weeks off after the sleeve gastrectomy. Having said that, if your work situation allows you to take more time off, we actually encourage more. We encourage more because that is going to be the time in which there is going to be gradual advancement in the diet, for instance, from liquids to a pureed diet, to soft chewable, and so forth. But the minimum time that we require is 2 weeks. In terms of the immediate recovery and what kind of physical activity the person can do, as I said in my presentation earlier on, we want the person to be walking. We don't want you to be sleeping unless you need to sleep and rest, right? We want you to be up and about. We tell our patients walk every hour if you can. Why is that important? Because that's one of the best ways, for instance, to minimize blood clots after surgery. So walking is very important. So patients often ask me, when can I start exercise? I tell them immediately because walking is a form of exercise. That's important, right? Now, there are certain exercises that we don't want you to do for a number of weeks. One of them is lifting weights, for instance. Lifting weights, doing any type of exercise that engage the core muscles of the abdomen, like crunches, sit-ups, or planks, things like that, have to wait 4 weeks after surgery. Okay. But other exercises like walking, treadmill, stationary bike, elliptical, we want you to start them soon, within days after surgery, obviously, gradually, to make sure to account for the level of energy that you have, because after surgery, energy is not going to be completely there. It's going to build up slowly, but it's not going to be there. So you have to take that into account as well. Let me see if there are any other questions. Okay, so the question that is coming up actually has to do with insurance, something different from our topic. And it is saying uh, if there are out of pocket costs and what is insurance coverage like. Well, essentially, the vast majority of insurances have matured enough now to cover bariatric surgery. There was a time when we first started, close to 20 years ago, when it was a fight with every insurance company to tell them that bariatric surgery is not a cosmetic procedure, it's a medically necessary procedure. But we've come a long way from that. The vast majority of insurance companies in our area, particularly, cover bariatric surgery. Now that includes the Medicaid insurances like Caritas, health options, of course, Highmark, Aetna, Cigna, Medicare. If the indications for bariatric surgery are there, they will cover it. Now, how much they cover and what are the out-of-pocket expenses is going to depend, obviously, on your plan. If there is a deductible, if there is co-pays, those may happen. I cannot really tell you specifically that. Your plan should be able to tell you that. But as far as insurance coverage is concerned, really, we've come a long way. Most insurance cover it, and for the right reason, because they know, even from an expense point of view, insurance companies understand that there are expenses in taking care of somebody who has morbid obesity, hypertension, diabetes, sleep apnea, joint pain, and many other illnesses is going to be way more than spending money for bariatric surgery, which as one treatment, by reducing the weight of that person considerably, by taking away the central problem, which is obesity, they will be able to ameliorate all the other illnesses as well. So one treatment to take care of different medical problems. So they've understood that. That's why they support fully bariatric surgery nowadays. The other question that came up was, how do I set up an appointment? Yeah, call our office. If you call 302-892-9900, that's our number. And you should be able to find that at crias.com as well, our website. You should be able to make an appointment. And there, as I said, there are 5 surgeons in our practice that specialize in bariatric surgery. Myself, Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, Dr. George Ibrahim, and all of us have at least 2 days, if not more, of office hours per week. So there is plenty of time for us to see patients who require bariatric surgery, and your appointment should be set up relatively soon after you call. But more importantly, most often, at least the first encounter can be undertaken through telehealth because of the pandemic, which makes it a lot more convenient for many people to be able to take time to have an appointment with their doctors and therefore with us as well. That's a great question that just came up. It says, Is it possible that the numbing medicine will prevent discovery of complications? That's a great question. I'm glad you asked that. And the answer to that is no, absolutely no. Why is that? Well, because the numbing medicine actually is taking care of the pain on the actual abdominal wall where we made the incisions. And that's what hurts most, right? That's what we are taking care of. If there is a complication, the pain will be coming internally to affect what's called the parietal peritoneum, which is the skin covering the inside of our abdomen. And then that person will have pain from, if there is a complication that shows itself up with pain, that person will have it. That's one point. The second point is the type of complication that cause pain do not happen that shortly after surgery, right? For instance, the one that we talk about is leaks. Leaks is one of the potential complications of bariatric surgery. Fortunately, in our practice, leaks are extremely rare, very, very rare. They can happen, we know, but they're rare. And if they do happen, obviously, we take care of them. But one of the ways in which leaks can present is with pain. But usually, the type of leaks that people present with occur days after surgery, not immediately after surgery. And the numbing medicine that I'm talking about is used really to take care of the immediate post-surgery pain, which is the one that will, if not taken care of, will hold the person in bed soon after surgery. We want that person to be up and about. That's why we utilize the numbing medicine. So the answer to the question whether it will hide symptoms from complications is no. Okay, I think that is it. That was actually a lot of very interesting questions. Again, I want to thank everybody for participating here. Next week, my friend Kamal Arkan, the chairman of the American Surgery Center, will be hopefully back, and he will be hosting another session. I will be next Tuesday with a different topic, either with myself or with one of my colleagues at CREAS. Again, everybody, thank you very much for taking the time to participate. I hope it was useful, and stay safe and have a great afternoon. Bye-bye.